About minor autohemotherapy. So how does minor autohemotherapy work? It consists of collecting 5 milliliters of the patient's blood, ozonizing those 5 ml and applying it in the glute. Or you can also work with 10 ml blood, ozonize it, and apply 5 milliliters in each glute. Minor autohemotherapies will not have the same function as major autohemotherapy. So, it will work to recruit macrophages to clean these cells, but it is a good response. In the patient's inflammatory state, it is not a therapy that you will do directly. I always assess the patient the need to use this therapy, but you can follow a protocol of once a week for this application, about 10 sessions. Take a break, and after about 3 months you return to perform this procedure. Why? You cannot keep doing it directly to avoid triggering. So the body ends up understanding that it will only function through minor autohemotherapy. So do it. Take a break of about 2 to 3 months before returning to do it according to the patient's needs. At least about 10 sessions are necessary, and give a break for the body to work according to the immune response. As for the micrograms used, I like to start with the minimum. In this case, I am doing it here with 10 micrograms. It's always good to start with the minimum. Remember that in ozonotherapy, less is more. So I always started with a low dose. So I started with 10, and then you can evaluate the patient with each application. You can increase by 5 each time till you reach 30 micrograms. Let's talk about intermediate autohemotherapy. Remember, folks, that intermediate autohemotherapy is not in the Madrid Code, but it is an adaptation, let's say, in a Brazilian way, where it consists of you treating the patient, collecting 10 milliliters of blood, or isolating and reinfusing it into the same vein from which you collected. You can use stop 21, or you can use a 30x7 needle that you can use directly, but it is better to use the scalpel as it is safer. You will ozonate, you will return the blood, just be careful that the oxygen in the syringe cannot be infused. Remember that from the moment you collected and have already mixed it with the gas, the ozone is already in the blood. So that air in the syringe is oxygen that we cannot infuse into the patient's vein. As you will see in the video, you will send the blood back, but when it comes to the air, you stop. Procedure is finished. So, start with the lowest, minimum dosage, which is 10 micrograms. Start with that. When I say application as high EMO, minor or major or intermediate, hello, how are you? Let's start our practical lesson on the application of auricular ozone therapy. First, we need to have this ozone stethoscope. It is a different stethoscope from the others. Why? It needs to be made of silicone. We cannot have anything that involves latex. Okay, so this is the proper stethoscope for auricular use. The indications include all infections of the head and neck, among them sinusitis, rhinitis, tonsillitis, all types of infections you can treat with auricular ozone therapy. This application is very simple. We will need to moisten a small piece of gauze. I already have a little ozonated water here. I will do it here. I will wet this small piece of gauze a little, where I will wrap the olive. Very simple. Okay. This is to provide more comfort to your client. Remember, everyone, that first you need to do a test with your patient to see if they have a perforated eardrum. Shall we, before the application of auricular ozone therapy, it is good to ensure that this patient does not have eardrum perforation, as it is a contraindication. Ask the patient to pinch their nose and exert pressure to see if there is air escaping from the ear. If not, if there isn't, everything is fine. You can start your therapy. Is that okay? Okay. We have already wrapped the olives in a small wet gauze with gas. By the way, we have already wrapped our olives with ozonated water. Everything okay? Let's go to our spinner. The dosage is 20 to 30 micrograms, okay? So here I will administer 20 micrograms with a 60 milliliter syringe. I already have my 60 milliliter syringe, 20 micrograms per milli. I will make the application. I will ask the patient when I apply to hold their breath for a moment. I will make the gradual application. I will apply 10 millis at a time. Hold your breath. Hold. Breathe. Ask the patient to breathe. I applied 10 ml. He breathes and hold your breath. Let's go again. Slow. Eat. Okay, let's go again. Hold your breath. Hello, how are you? Now we will start our practical lesson on ozonated cupping therapy. What is ozonated cupping therapy indicated for cases of pain? It is generally indicated for patients who are more resistant to needle application. So, it is good to offer cupping therapy. This will help improve pain and enhance local circulation. We will use a microdosing of 5 micrograms per ml in a volume of 10 ml. Shall we go? We have here the sizes of the therapy cups. I will use the largest one for the area I am going to work on now. Remember, everyone, that we need to have latex-free adapters, and this one here has a little tap and a small silicone connection. There are larger ones, larger connections, but it has the same effect Okay? What are the benefits of ultrasound cupping therapy? The benefits are local oxygenation, improved circulation, and pain relief. Many times our patient is resistant to needles. It is a good treatment option. Satisfactory results. Shall we go? The cup comes in 4 sizes, ideal for each region of the body that you will use it on. So we will use the larger ones on the shoulder and back, while the others can be used on any part of the body, like legs and arms. Okay? So there are 4 sizes of therapeutic cups. Let's do the placement. I will get a syringe. I got a syringe. I will connect it here to my little tap. Okay. Remembering that I need to remove the ambient air, I open the little tap. I close it. A little more. I took the 20 ml syringe. Concentration. I want 5 micrograms. 5 micrograms. My device is digital, so I don't need to control the oxygen. It does all of that, the device. And I will collect 20 ml here. Connect my syringe. I will open for the syringe and I will make the application. I close. I place 20 ml with 5 micrograms here in my patient. I close. Let's leave it for 5 to 10 minutes. Hello, how are you? Let's now start our practical lesson on hair bags. What will you need for this procedure? Your ozone generator, an extension, this silicone extension here. You will need the bag. We already have the bag in a cap shape specifically for this procedure. It's a little cap, okay? Material free of tin or cold latex. You will need the little adapter where you will connect your bag. Or you can use, instead of the adapter, a probe that you will connect to your silicone extension directly. So you have 2 options. In this procedure, use the probe, adapt your extension, or the adapter, connecting directly to the extension. Shall we move on to the practical part? Let's move on to the practical part, our hair bag procedure. We can see that our patient is a young patient, 28 years old, and has little hair in this area. She has significant hair loss. So she is a patient on whom we can perform subcutaneous application in this area where there is less hair and the hair bag. The hair bag will not only act on eczema and seborrhea, but also on the hair. It will give vitality to the hair. Shall we proceed? Let's put on our bag. I have already adapted it. I will use this little probe, okay? Because here you will discard the post. So to avoid using the extension directly on your patient, you will use a probe, okay? A probe. It's already connected to my device, okay? To the filter. I will turn on the device. Concentration. I will make a concentration of 30 micrograms. I carefully and precisely place the probe, ensuring it remains external, not in contact with the patient's scalp. And securely, I have simply and completely already turned on the device. Cooler. And now we will wait. This procedure you will leave for 15 minutes for the action of ozone directly on the scalp. To enhance the action of ozone, you can humidify. You will ozonize a little water. Spray it all over the hair, leaving it damp. This will further enhance the effect. You will perform at least 20 sessions. After that, you will reassess your client and see the need. You will associate this treatment with ozonized fat with subcutaneous application. For subcutaneous application, you will also perform the applications twice a week for a minimum of 20 sessions and will reassess your client.
Let's now talk about the quantity and concentration you will use for localized fat. It's 10 micrograms, 240 milliliters of volume, where you will distribute this 240 milliliters throughout the patient's abdomen. Let's go. Let's make some lines. Guys, the space is about 2 centimeters, okay? It will be about 2 fingers apart. Okay? At each point, you can be applying 1 to 5 ml. Remembering that we have 240 ml to distribute throughout the abdomen. Guys, let's do the sepsis, okay? And this whole area. It's okay if it goes out. Okay? No problem. You know, it's 2 fingers apart. I have a concentration of 10. I'm using a 20 ml syringe, 90-degree angle. Let's start by making a clamp, okay? Hold it. 90-degree angle, insert it. It is important to massage it to spread all the gas in the abdominal region. Remember, concentration of 10 micrograms, 240 ml to be distributed throughout the patient's abdomen. Also, guys, you can associate the rectal insufflation treatment to help with the weight loss process. Guys, it's important that you close a package with your patient of at least 10 to 20 sessions. Remember that you have to guide your patient in terms of diet and exercise. All of this to integrate your treatment, right? Because there is no point in undergoing a treatment with neurotherapy and continuing with the same eating habits that unfortunately do not produce the results. It will not be what was expected. So, guide the patient regarding their diet, physical exercise, water intake, which is important, okay? But let's think about the benefits it will bring us, okay? So, I'll be using it for you to see. I like to, when drinking it, hold my breath, cover my nose, so I don't feel that taste when I'm drinking the water. But let's think about the benefits that this water can bring us. Also, not only for consumption, but you can ozonate this water to wash vegetables, legumes, and also for use, such as cleaning the skin, cleaning lesions. When you are going to make the bag, it is important to clean it with either ozonated serum or ozonated water. Remember, it is ideal to use double distilled water, okay? It has better quality. So you can use water for whatever you want, right? From drinking to washing and sanitizing food. We're done, okay? I ozonated my water for 12 minutes. I turned off my generator. I'm now getting my water to drink. I'm here with the water. Guys, the smell is really bad, okay? So I'm going to ingest it. I'm going to do this here because it's really strong, okay? Not pleasant, okay? Not pleasant at all. But that's it, folks. But let's think about the benefits it will bring us, okay? See you later.
The foot bag is an effective application for treating circulatory problems, fungal infections, wounds, and inflammation. Place the bag with the silicone hose and seal it well to prevent gas leakage. Adjust the concentration between 30 to 40 micrograms until the bag is full. Once the bag is full, let the ozone act for 15 to 20 minutes. Always adjust the concentration according to the patient's condition and the treatment objective. The recommended treatment is at least 10 sessions.
Let's start our application on stretch marks. Now, remember that the microneedling is 10 micrograms, and you can apply 1 ml on each stretch mark at each point. Shall we go? We can see here that it is a region that has many stretch marks. I will start with this one here. Remember, alveoli upwards. injected 5 milliliters. You can see the aspect here, how it has improved here. So I can apply 1 to 5 ml, this concentration of 10. You can do a protocol twice a week. After application, we will use our ozonated oil and we will do a massage. To spread out all this gas here, remembering, guys, that the angle here is 15, okay? 15 degrees the angle when applying stretch marks. Now let's apply it to the glabellar region, which is where the little wrinkle called crow's feet is located, in this region here around the eyes. Let's go. A sepsis. We did a sepsis, bevel upwards. I have this thinner needle. Did you notice that the gas ran here to the upper eyelid? The point we took was here, and the gas went up to the upper eyelid. You saw that it even created volume here in his upper eyelid. A massage with ozonated oil, it can be sunflower oil, coconut oil, olive oil. Small amount. Massage a little to spread this gas throughout the area. We will now apply it to the scapular region. The patient reports feeling a lot of pain in this region. Let's go. The patient reports pain in this region. We can then use micrograms from 5 to 20. I am using 5 micrograms because it is the patient's first time. So I'm going to apply it to this region. We're going to perform the sepsis. Perform the massage here with ozonated oil, spreading all the gas throughout this region. When there is inflammation, it is common for it to be a little more painful, okay? Remembering that the gas, ozone, is an intelligent gas. It acts through chemotaxis. It goes to the place where there is inflammation, and this can cause a little pain. Don't pick up a vase, okay? So free up the vase spaces and you can fill them in. So, using here 10 milliliters of the gas volume with a concentration of 5, which I started here in this more hydrated and clearer skin. Look at the difference. This will stimulate collagen production. And with that, rejuvenate these hands. Now let's apply the treatment on acne. You can apply it directly on the lesion, on the acne itself. Remember that it is always good to associate a lower autoemol because the lower autoemol will help in the process of phagocytosis of these cellular debris from inflammation and infections present in the patient's body. So it is always good to associate a lower autoemol. Shall we proceed? Let's perform antisepsis of the area. 1. Acne. Concentration of 5 to 10 micrograms, 0.5 ml from 0.5 to 1 ml, directly on the acne. Is always important. You can apply it to each of the lesions. Let's do the application now. In the armpit area for whitening. We can also do it in the inguinal area, the groin. It is an intradermal application, and the concentration is the same as we use on the stars, 10 micrograms. You can apply from 1 to 5 ml. Let's do the antisepsis in the area. Words. Massage folks to spread this gas throughout the entire area. Guys, it's immediate. I don't know if you are noticing, but it has already lightened this area quite a bit. So 1 application bi-weekly, 5 applications, and you will already have excellent results. Let's perform our application now in the double chin area, shall we? Let's carry out the hygiene. Let's create the fold. Okay, it's important to make the fold. I applied approximately 5 ml in this area, but you can apply 5 ml in the center, in the middle, and 5 ml on each side as well. Remember that in this area here, you can be using it here and also on the sides, not in these areas here. Okay, so we will apply it here in the middle or on the sides. This patient of mine doesn't have much double chin, but a patient with a more voluminous double chin makes it easier for you to perform the application. After the application, always the massage with ozonized oil. Remember that ozone is well used for alopecia treatments. Shall we go? Our patient has any gaps in this area, very little hair here. So we will just start by making the markings. We can start marking. Since he has a lot of gaps here, I can do this. Start the application from here. Remember that the distance between points is about 1 finger's width. You mark approximately. If you also want to make the markings with a pen, you can, but you can also do it with your finger. Leave a finger's width of distance, and you will apply 1 to 2 ml at each point. This area is very oily, the scalp, and the pen mark doesn't stick properly. Okay, so let's perform antisepsis on the entire scalp. You can use 70% alcohol. I will start in this area here, okay? We have already performed antisepsis. Remember that the bevel should be facing up. Antisepsis has already been performed. Remember that the bevel should be facing up. Right at the tip, okay? No need to go deeper. Applied at this point, I give about a finger's distance and come here, bevel up. Space and continue applying in this entire area. We will now perform the application on the forehead expression lines, where you raise eyebrows and make these expressions so that these marks become well defined. Let's go then. This patient has some already very deep lines. These expressions here are quite pronounced, very deep, you see. Let's do the antisepsis. I will place my hand here to prevent the gas from descending to the eye area, okay? So, shall we proceed? Descends to the eyes and causes discoloration. This is common. Why? Ozone acts through chemotaxis. Wherever there is an inflammatory process, it will go ha. So if there is any inflammatory process here in the conjunctiva, which is the eye area, this gas will descend and cause swelling and edema here. But there is no problem. This will gradually go away. Within 3 days at most, all this edema will have disappeared. Just advise the patient to do some eye massage from time to time, which is not a problem at all. Did you notice that the gas rose to this area here? So the gas spreads. The important thing is just to do this little massage. You can use ozonated oil or any oil, sunflower oil, coconut oil as well.
Hi, how are you? Let's now go to our practical lesson on coffee enemas. Shall we go? So, I'm going to start by telling you that I've already made my coffee. My coffee is ready here. How did I make this coffee? I used 350 milliliters of water. I used distilled water here. You can use distilled, double distilled, or reverse osmosis water. It has to be clean water, okay? You can't use tap water, but you can also use filtered water. I used 300 ml of distilled water for 3 tablespoons of organic Arabica coffee. I made my coffee, I strained it, and it should be strained through a stainless steel filter, okay? Or you can also use a cloth filter. Always use a glass container. Don't use aluminum, because aluminum will release byproducts that can, unfortunately, harm our health. Use a container, a ceramic milk pot to boil the water, okay? So I've already strained my coffee. I made it with 350 ml of water and 3 level tablespoons. And I added another 350 ml of cold double distilled water, okay? I sat down here, put 350 ml of cold double distilled water. So my coffee is ready. It's here in this glass jar. I'm going to show you what I'm going to use from my kit. This kit here is an irrigation kit. Which one am I going to use? This kit of mine is quite complete. It even has a temperature gauge. If the temperature is between 35 and 36, it will show up here in blue. If it's between 37 and 38, it will show up in green. If it's between 39 and 40, it will show up in red. So this kit of mine already has this thermometer. But if you're using a kit that doesn't have a thermometer, it's important to check the temperature of the coffee. It can't go over 37 degrees. Let's stay between 36 and 36.5, okay? So I'm going to put my kit here, which already has this opening. Okay, and now let's put the coffee in here. I've already closed it here. It has a valve right here. It's closed so the coffee doesn't spill over to this side. Shall we go? Let's put our coffee in our bag. I have my coffee in the glass jar, so I'm going to put it in my bag. We've already inserted the catheter. This enema kit of mine is an irrigation kit. It has the advantage that it has a valve where I'm going to control the flow of the coffee coming in. I go. Increase it. I can infinitely increase the flow. When it's running, it means the flow is going through. The coffee is coming in, not too fast. Normal speed. Keep talking to the patient, asking if everything's okay. Are you okay? Are you holding on? Ask the patient to heal. So let's keep going until the infusion of all the coffee is done. We've finished the entire enema infusion. Now I'm going to remove it. I'll talk to the chief patient, asking them to stay relaxed and hold the solution in their intestines for 15 minutes so that the intestines can absorb all the nutrients present in the coffee. After 15 minutes, the patient goes to the restroom, goes to the toilet, and releases all coffee. And that's how we finish our coffee enema. Interesting. The coffee enema is really good for pre-ozone. Do you want to have a good result with the rectal insufflation? Do the coffee enema first. You will have better absorption of ozone. So it's two therapies that come together to bring excellent results for your treatment and for your patient's well-being. See you next time.
but the benefits are quick and significant for relieving pain. I have already performed asepsis of the area with 70% alcohol all over the plantar region. Now we are going to start. I will apply the gas directly at the point of pain that I previously identified with my finger. I made 3 application points. After this, we will distribute the gas through a massage. Ozone acts through chemotaxis, directing itself straight to the inflamed area. For this reason, I carefully distribute the gas at 3 points on the patient's foot.